What's the difference between rheumatoid arthritis and fibromyalgia? What are rheumatoid arthritis and fibromyalgia? Rheumatoid arthritis, RA, and fibromyalgia are two different conditions with some similar symptoms. These include pain that may feel like a dull ache, sleep disturbances, fatigue, feelings of depression and anxiety. The causes of these conditions are very different. RA is an autoimmune disorder that causes the body's immune system to attack its joints. Fibromyalgia is a disorder marked by musculoskeletal pain and symptoms of fatigue, trouble sleeping, and problems with memory and mood. While the Arthritis Foundation, F, considers fibromyalgia to be an arthritis-related condition, there are clear differences between the two conditions. RA and fibromyalgia progress very differently. Fibromyalgia usually causes constant pain that may worsen with poor sleep and stress. On the other hand, RA can flare up and grow progressively worse without treatment. Talk to your doctor about your symptoms, and give them as much detail as you can. Knowing what you're experiencing can help your doctor make a more accurate diagnosis. How are the symptoms different? While both conditions have similar symptoms, the causes of each symptom, as well as the way people with each condition experience them, can be different. Experiencing pain is common in each condition, but the triggers aren't the same. One of the biggest differences between RA and fibromyalgia is inflammation. In RA, joint inflammation is one of the key symptoms. People with RA often notice that their joint pain appears on both sides of their body. For example, if you have a painful joint in your right wrist, you also may have corresponding pain in your left wrist. A 2002 study showed that people with RA and those with fibromyalgia both had more trouble paying attention than those in the control group. About 63% of people with fibromyalgia report lower back pain, while about 47% report frequent headaches, joint pain, muscle spasms, tingling. Another study, published in the journal Pain Practice, compared people with fibromyalgia and RA to a healthy control group before and after exercise. Researchers found that people with RA showed decreased pain after exercise. The results were not significant for people with fibromyalgia. Sleep disturbances and fatigue. Both conditions can cause sleep disturbances and fatigue. But sleep problems in people with fibromyalgia tend to be more draining. A preliminary study found that women with fibromyalgia reported greater daytime sleepiness and fatigue than women with RA. However, the multiple sleep latency test, MSLT, shows that women with fibromyalgia had less objective daytime sleepiness compared to women with RA. With RA, fatigue can also be a result of inflammation and anemia. Anemia, or the lack of red blood cells, affects up to 2/3 of people with RA. Another study, published in Journal of Psychosomatic Research, found that reduced sleep affected women with fibromyalgia more than women with RA. Women with fibromyalgia reported feeling more daytime sleepiness and needed a longer recovery time. Depression and anxiety. Feelings of depression and anxiety are common symptoms of fibromyalgia and RA. These feelings can affect your quality of life. A 2007 study found that these feelings were not statistically different between people with RA and fibromyalgia. Distinct symptoms. While RA and fibromyalgia can have many symptoms in common, each condition also has its own unique set of symptoms. Distinct symptoms of RA. With RA, symptoms often flare up, or come and go, periodically. Common RA symptoms include joint pain, tenderness, and stiffness. Red, swollen joints, often in your hands or feet. A sudden increase in symptoms that intensify for a period of days to months before temporarily subsiding. Inflammation. Inflammation can affect other parts of your body, such as your eyes, dryness, sensitivity to light, and impaired vision. Mouth, dryness, irritation or infection of the gums. Skin, small lumps around the bone areas. Lungs, shortness of breath. Blood vessels, organ, skin, or nerve damage. Blood, anemia. About 40% of people with RA also experience these signs and symptoms, according to the Mayo Clinic. Distinct symptoms of fibromyalgia. The symptoms of fibromyalgia can appear like symptoms of many other conditions. But the pain in fibromyalgia is widespread and tends to occur on specific tender points. These points are located in symmetrical pairs on the back of your head, collarbone area, upper back, elbows, buttocks, knees. You may also have trouble with memory, often called fibro fog headaches, menstrual pain, restless leg syndrome, sensitivity to temperature, loud noises, or bright lights, numbness or tingling, irritable bowel syndrome. Fibromyalgia pain can appear in the joints and muscles, but fibromyalgia doesn't damage your joints the way that arthritis can. It also doesn't damage your muscles or other soft tissues. The pain of fibromyalgia can worsen arthritis pain. Getting a diagnosis: doctors use different techniques to diagnose RA and fibromyalgia. But, in each case, you'll want to give your doctor as much information about your medical history and the symptoms you're experiencing as possible. Diagnosing RA: there's no single test for RA, so your doctor will perform a complete medical history and physical examination. They'll also conduct several tests to help confirm a RA diagnosis. These include a review of your medical history and that of your family, a physical exam to look for joint tenderness, swelling, and pain, blood tests to look for inflammation, autoantibody tests. About 80% of people with RA have the rheumatoid factor antibody, imaging tests, such as ultrasound, to look for joint damage or inflammation. Your doctor will immediately recommend treatment if you have RA because the condition requires prompt treatment. If left untreated, RA symptoms can lead to long-term joint damage. Serious cases of RA can even cause damage to major organs, including your heart. Diagnosing fibromyalgia: fibromyalgia diagnosis can be difficult to confirm. While there may be clear signs and symptoms, there isn't one test or examination that can determine if you have fibromyalgia. One of the best ways for your doctor to help diagnose fibromyalgia is to rule out other conditions. There's no cure for fibromyalgia, but there are treatment options that can make a difference in your quality of life, including lifestyle changes and medication. Can RA and fibromyalgia symptoms be a sign of another condition? Joint pain, fatigue, and muscle pain can also be symptoms of other conditions. Some of these include lupus, an autoimmune disease that causes damage to any part of the body; Sjogren's disease, an immune system disorder that also has symptoms of dry eyes and mouth; hypothyroidism, low levels of thyroid hormone that causes pain all over; multiple sclerosis, an immune system disorder that attacks the central nervous system; sleep apnea, unrefreshed sleep that causes fatigue. Talking to your doctor about all your symptoms can help them determine what's causing your discomfort. See a doctor if you're experiencing any of the symptoms associated with either RA or fibromyalgia. Make an appointment with your doctor. Even though these conditions share similar symptoms, the treatment and outlook for each is very different. Your doctor can help diagnose the condition and recommend the right treatment. It's also important to treat RA early because RA leads to serious complications as it progresses.